Hi, I'm Dr. Mary Kelly. I'm a staff psychologist at Counseling and Psychological Services, also known as CAPS, here at Seton Hall.
And I'm Dr. Stephanie Lyon, also a staff psychologist at CAPS, and we're here today to talk about panic attacks. What is a panic attack? It's normal to experience anxiety from time to time. In fact, almost everyone does, but anxiety exists on a spectrum. On one side, you have total calm or no anxiety. On the other side of the spectrum, you have extreme anxiety or panic. Experiencing some anxiety can be normal and even helpful. Think about the worry you have before a big exam. That can motivate you to study more and can even make your mind sharper. But panic attacks are at the very extreme end of the anxiety spectrum. What makes a panic attack different from other anxiety? Panic attacks are brief but very intense, in contrast to general anxiety, which is usually less severe but can last longer. Panic attacks usually peak within minutes, and then you begin to calm down.
So why do people have panic attacks? Some people are more prone to having panic attacks because of a genetic predisposition, coupled with major stressors in their environment. Sometimes you may be able to clearly identify the trigger for a panic attack, but other times they may seem to just come out of the blue. Then there is something called the fear cycle. Some of us are just more prone to be sensitive to the subtle changes that are always occurring in our bodies. So if you feel maybe a slight twinge or a pain someplace, your mind automatically jumps to, oh my God, there's something seriously wrong with me. This starts a chain reaction in which your body and your mind go into high alert. This is because humans have a natural hormonal response to threats, which triggers something called the flight or fight response, which either gets us ready to flee the danger or fight it if necessary. It doesn't even matter if the threat is real or perceived. Your brain treats it the same way and starts that process of the chemicals coursing through your body, which can create more unpleasant symptoms, triggering more fearful thoughts, and so on.
Physical symptoms of a panic attack include increased heart rate, muscle tension, rapid breathing, heart palpitations, dry mouth, and sweating, weakness, dizziness, shaking, or feeling hot or cold. Thoughts and feelings that often come along with panic attacks include intense fear, feeling out of control or crazy, feeling that you may be dying, and things in your environment may feel unreal or far away. All of these symptoms have an adaptive physiological reason. For example, your heart races because it's pumping oxygen to your large muscles so that you can fight or get away from the perceived threat. Remember, none of these symptoms are dangerous, they're just uncomfortable, and sometimes just knowing the reason we have them can help us feel calmer.
So now we understand a little bit more about what happens mentally and physically during a panic attack. So let's talk a little bit more about how to keep anxiety from escalating and what to do if you actually do have a panic attack. As we said earlier, anxiety is a natural and even beneficial human experience. But there are things that you can do to proactively manage your stress and to lower your baseline anxiety. For example, make sure you're getting enough sleep, make sure you're exercising regularly, that you're eating nutritious foods, drinking plenty of water, and avoiding excessive use of substances, including caffeine. Also, try establishing a regular mindfulness or meditation practice. And here are some apps to help guide you.
If your anxiety does escalate to the point of a panic attack, here are some things you can do to try to help yourself cope. First, try to ride it out. It's important to remember that panic attacks are not dangerous, they're just uncomfortable. No one dies or loses their mind from having a panic attack. Also, although they are very intense, they often pass quickly, rarely lasting longer than 20 minutes. You will get through this. Another good method that can help you cope with a panic attack is called grounding. Grounding encourages you to stay focused on the present. This can help you feel less stressed and less overwhelmed. There are many different strategies you can use for grounding. We'll share just a couple examples. Some of these may seem a little silly, but they really do help. For example, try to name an animal for every letter of the alphabet.
Ground yourself by looking around and noticing your environment. Identify 5 things that you can see, 4 things that you can touch and actually touch them, 3 things you can hear, 2 things you can smell, and if possible, 1 thing that you can taste. Even just finding the words to describe what you're experiencing in the moment can help to calm you.
Trying to steady your breathing can also be a very helpful way to cope with a panic attack. Here are a few simple ideas for getting in touch with your breath. Place your hand on your chest or your belly. Feel your hands rise and fall with your breath. You could also close your eyes and try to count your breaths. You could also try to close your eyes and imagine a color that makes you feel calm. As you breathe, imagine the color flowing into and out of your body.
Remember, panic attacks are not dangerous, they're just uncomfortable. And as you've seen, we can develop skills and techniques to manage our anxiety and panic. However, if you feel that you're having difficulty managing your anxiety or panic attacks and you feel as though you could use some additional support and maybe learn some more techniques, please reach out to us at CAPS. We're located in Mooney Hall on the 2nd floor.